focus ultrasound is the best modality to penetrate signal to deep inside body. It is very unique advantage that focus ultrasound has. So we have to make more trial to know what focus ultrasound would be in future medicine.
Welcome to Curing with Sound, a podcast presented by the Focused Ultrasound Foundation. I'm your host, Dave Hendrick. Dr. Jae Young Lee is a professor of radiology at Seoul National University College of Medicine and Seoul National University Hospital, where he also serves as Chief Innovation and Quality Officer. He's a recognized leader in focused ultrasound, and his pioneering research is advancing the use of the technology to treat cancer. Dr. Lee has published more than 200 articles in international peer-reviewed journals and has delivered over 100 lectures to audiences around the world. He recently visited the Focused Ultrasound Foundation to share the results from his clinical trials, and we sat down to discuss his innovative research. Dr. Lee, welcome to the podcast.
Thank you. I'm very happy to be invited in such a wonderful podcast.
Dr. Lee, can you tell us a bit more about your background and how you became interested in focused ultrasound?
I had experience to treat pancreatic cancer patients with old model focused ultrasound device. At that time, I realized that we didn't know much about focused ultrasound. What is the best for patients? What is the best parameter to treat patients? At that time, we just knew focused ultrasound is used for thermal ablation. But when I reviewed articles, focused ultrasound has diverse phenomena such as drug delivery and immune modulation. So that is the reason I became interested in focused ultrasound.
When you appeared on the podcast in late 2024, you had recently completed a phase 2 clinical trial that found high-intensity focused ultrasound plus the chemotherapy drug fulfinarox to be safe and effective for patients with pancreatic cancer. And you were looking ahead to phase 3. Can you catch us up on the state of that trial?
Since we last spoke, we used the phase 2 data to finalize to the phase 3 pivotal trial framework. This study is designed as a multicenter, randomized trial in the United States and Korea with overall survival as the primary endpoint. Right now, we are finalizing the protocol and completing contract and preparing regulatory and IRB steps. Our goal is to start enrollment as soon as all approvals and site activation are in place. What's exciting is that phase 2 gave us a clear signal, better response, and a consistent survival trend without added toxicity, which is exactly what you want before moving to a pivotal trial.
You're using focused ultrasound for mechanical stimulation. For our listeners, can you explain that mechanism of action versus, say, ablation?
Okay. Ablation is like burning or destroying tissue to kill tumors directly. Mechanical focus ultrasound is different. We are not trying to burn the tumor. Instead, we deliver ultrasound in a way that creates mechanical effects, micro-level stress and changes in the tumor environment. The goal is to improve drug delivery and potentially modulate the immune microenvironment so chemotherapy can work better.
Now, assuming continued success, what sort of impact do you expect this research to have?
If the result hold in phase 3, this could become a new adjunctive strategy to pancreatic cancer, not replacing chemotherapy, but making chemotherapy work better. Pancreatic cancer is notorious difficult because drugs often don't penetrate well and the microenvironment is resistant. So even a modest improvement in delivery and response can translate into meaningful survival benefit. More broadly, it may open a pathway to combine ultrasound with modern systemic therapies, including immunotherapy.
And taking a step back, can you remind us how you became interested in using focused ultrasound to treat pancreatic cancer?
I became interested because pancreatic cancer has such a poor prognosis, and we urgently need new approaches. As an ultrasound physician, I also feel focused ultrasound could be more than pain palliation or ablation. The concept that we could use ultrasound to modulate biology, drug delivery, and immune response really motivated me. It's a bridge between engineering, imaging, and oncology.
One of the clinical trial participants was Gapsu Han, a man in his 70s who was diagnosed with pancreatic cancer in 2021. I believe he was among the first to be treated with focused ultrasound for pancreatic cancer. Can you tell us a bit more about Mr. Han and how he's doing now?
Mr. Han's story stayed with me because it reminded me that behind every trial is a person and a family. As of now, he visited our hospital for OPD follow-up next October, and he underwent CT scan, and he's doing well with no evidence of recurrence. When you see a patient respond better than expected, if it changes the entire team's energy, and it gives us the drive to push forward to the next trial.
In addition to your work with pancreatic cancer, I believe your team at Seoul National has also used focused ultrasound to open the blood-brain barrier and clear amyloid plaque in preclinical studies. What's the status of that research?
We have continued the line of research in preclinical models. Focused ultrasound can transiently open the blood-brain barrier, which may allow better delivery of therapy. And we also explore effects on amyloid pathology. At the moment, the work is going in preclinical stage. The key focus is safety, reproducibility, and identifying the most meaningful biological endpoints before any clinical translation.
One of the earliest clinical uses of focused ultrasound is for uterine fibroids, and I know you've been part of ongoing research in that field. What's the status of your work regarding focused ultrasound for uterine fibroids now?
We did conduct clinical research using the Alpinian focused ultrasound system with a transvaginal approach for uterine fibroids and adenomyosis. However, the particular program did not move forward to commercial adoption. The main reasons were financial pressures on the company and the fact that the clinical impact did not turn out to be as large as we had initially hoped. Even so, that experience was extremely valuable. It taught us what works, what does not, and how to design better and more impactful focused ultrasound therapies going forward.
So Seoul National is a leader in focused ultrasound with a Center of Excellence designation from the Focused Ultrasound Foundation. Can you tell us about some of the preclinical work being done by your team and colleagues?
More recently, we have installed an Insight Tech focused ultrasound system and our institute. Our neurosurgical colleagues are now actively using it for both clinical treatments and research. And Dr. Lee, a neurosurgeon, is performing some research on BBB opening and leptomeningeal metastasis reduction with our research professor Park. Our anesthesia team is also conducting research related to pain modulation using focused ultrasound. Although those studies are still in progress, and I don't want to overstate where they are exactly at this moment. So focused ultrasound is not just a research topic for us. It is now part of real clinical practice in our system.
So focused ultrasound has regulatory approvals worldwide and rising recognition, but awareness remains a key barrier. What's the state of focused ultrasound awareness in Korea, and what are the barriers to broader adoption?
Awareness is improving in Korea, but there are still barriers. First, reimbursement and regulatory pathways can lag behind innovation. Second, focused ultrasound often requires specialized equipment and trained teams with limits availability. Third, many clinicians still think ultrasound therapy only means ablation. So we need education about newer mechanisms like mechanical stimulation and immune modulation. To grow adoption, we need strong evidence, clear guidelines, and training programs.
What excites you most in the field right now?
What excites me most is that focused ultrasound is becoming a platform technology. It can ablate, modulate, open barriers, enhance delivery, and potentially engage the immune system. And it can do this without incisions. The combinations ultrasound plus drugs plus immunotherapy are especially exciting.
And so if you could wave a wand and remove one obstacle holding back focused ultrasound from wider adoption, what would it be?
I think one of the biggest obstacles is that there is still much we do not fully understand about ultrasound as a therapeutic tool. Focused ultrasound has enormous potential, but to realize that potential, we need more researches and more sustained research funding to build strong, high-quality evidence. The more we invest in rigorous science today, the more confidently we will be able to bring these therapies to patients tomorrow.
For listeners who may be new to focused ultrasound, what makes this technology different from everything that came before it?
Focused ultrasound is unique because it can deliver energy deep inside the body without any incision, and it can create many different biological effects. Because of that, there is still more we do not know, so we have to make more trial to know what focused ultrasound would be in future medicine, and that is exactly what this field is so exciting.
Dr. Lee, thank you so much for telling us about the important work you're doing on the Curing with Sound podcast.
Thank you so much.
This episode of Curing with Sound has been presented by the Focused Ultrasound Foundation. If you'd like to learn more about Focused Ultrasound or the Foundation, visit our website at fussfoundation.org. You can also sign up for our newsletter, News Digest, and follow us on social media. Be sure to subscribe to the Curing with Sound podcast so you don't miss the latest information on focused ultrasound. We would also be grateful if you would rate and review the show.